So today I'm going to show a few techniques on how to adjust the neck, the cervical spine. The neck is probably one of the most nerve-wracking areas to actually work on for a lot of people. People get really nervous about it. It's very close to the head. You can hear the adjustment a lot louder through that area. It's probably one of the most important areas to adjust as well because everything works above, down, inside out. Starts at the brain, goes down the spinal canal, runs to all areas of the body. So the neck is a very important area and controls a lot of areas of the body. There's different types of adjustments you can do. There's a manual technique, there's a drop technique, a Thompson drop technique, there's also an activator technique as well. So I'm going to show you all three of them. The first technique I'm going to show you is the drop technique. The drop technique, the Thompson drop, there's a little lever underneath the head that actually raises the head up just a little bit. So what I'm going to do, I'm going to go right underneath. It's going to raise up just like that. And all I'm going to do is I'm going to go right behind. I'm going to find the certain bone that's moved out of place in a certain direction it's moved. Go right there with both hands on each side and give just a little push down. When that happens, the table is going to drop underneath it, and it helps to kind of ease that bone into place. It's a very light technique. It doesn't torque the spine. It doesn't put any pressure on the body. It doesn't put a lot of pressure on the disc pad. It just helps to get that bone to shift and move underneath there as well. So we use it on a lot of our patients who get, they'll get radiating symptoms down the arms. They may get headaches. They may get just having trouble trying to turn their neck or move like that as well. So the second type of adjustment that we use in the office is called an activator technique. The activator is using a tool that looks just like this. What it does, it puts a small force into a concentrated area, and you're able to shift that bone and get that bone to move into place as well. So it takes the pressure off the nerves. You're able to get those muscles to calm down around that area. It's a very light technique that our patients seem to love. Works good for patients from babies all the way up to 90, 100 years old. Patients that have fibromyalgia, patients that have osteoporosis. It's a light technique that you can get that bone to move without damaging anything. So the same type of thing, we're finding a specific bone, we're getting that one bone to move, and we're getting right in here, we're putting pressure right onto that bone, and just put a thump like that. Helps to take that pressure off that bone, get that bone to shift underneath there as well. So a lot of our patients seem to really love it. The last technique that a lot of people get nervous about is the manual technique. The manual technique is the typical popping and cracking that you think of with it though. It's not like you see a lot of people where they take their own neck and they go like that and you're feeling a bunch of pops all in the neck with it though. The difference between that and chiropractic is that chiropractic you're looking for a specific bone, you're getting that one bone to move, and you're getting it to move in the direction that you want it to take the pressure off those nerves. So the difference between doing it yourself and chiropractic is all about specificity. So in that, we're looking at the neck here again. We're finding our one specific bone that we want to get to move. There's a little pressure right on the side of the neck. You bend the head to the side, rotate to the opposite direction, find the angle that you want to get to move, and then give just a little push like that. What that does, you're feeling a little audible when that happens. You're going to hear a pop. The pops in your neck are way louder than anywhere else in your spine. Just because they're close to your ears, you're going to hear it a lot louder. Most people think it feels really good though and everything. It's a little scary, but it feels great on it though as well. So it's a great technique to get that pressure off, get the pressure off that nerve, get those muscles to relax across there. People that have a hard time turning their neck side to side and they wake up in the morning like that, it does very well on them. Works really good for headaches as well, migraines. We see a lot of patients that come in with issues like that. So those are a couple techniques for the neck. Hope you got through it and it wasn't as nerve-wracking as you thought it'd be. And thanks for watching, guys.